Thank you, Cynthia. Appreciate it very much. I have a couple of PowerPoint slides because I think that sometimes a picture is worth 1,000 words. The reference was made to the Blue Ribbon Commission for Healthcare Reform, and there are several commissioners in here right now, and I'd like Elizabeth and Alan and Ralph and also the staff, Anita, anybody else, would you please stand so that people can see you, please? Alan, Elizabeth? These people made a tremendous commitment and time commitment and energy for the state of Colorado and for all of us. We have a copy of the presentation, the report from the commission. It'll be at the back table on your way out. We had a little snafu. We were going to put it in your packet, but for whatever reason we weren't able to do that. I'm very humbled to be here. I'm certainly not a PhD in economics, and I'm not the CEO of a very successful health system and not a state official. I am a notary public, if that gives me any credibility. But what I want to do is just make a couple of quick comments because I think it's important. It's great to have a pep rally about healthcare reform like this, but I think it's important to put it in perspective and to help think about some of the key pieces of this. So this is my attempt at a very feeble diagram. Stephen, you'll recognize parts of this. This is what I've called the healthcare financing crucible. And by the way, this is not the Blue Ribbon Commission for Healthcare Reform. It would have been a lot more efficient and effective if it was. This is Bill Lindsay's comments, so please don't attribute that back to the commission. But when you think about healthcare reform, it's really very simple. There's a couple of variables that you tweak, and that determines what the outcome is going to be. So if you start at the bottom right-hand side, the first one is enrollment. Who is going to be involved in this system? Are we going to do away with the employer-based system and put everybody in? Is it voluntary or is it mandatory? And how easy is it for people to enroll? On the other side is eligibility. These two are related, but they're different. Is this system and is the contribution that people pay based on their income? Is it based on total family income? Is it based on disability status? What is the eligibility criteria to get into this system? Those flow up and are then influenced by two other variables. One is the healthcare delivery model. One of the things that I learned during the process with the Blue Ribbon Commission for Healthcare Reform was that if we waved a magic wand and covered everyone in Colorado today, we wouldn't have enough physicians to treat them, primary care physicians. So one of the questions is, what is the care delivery model? Is it traditional physicians, or could it be allied professionals, paraprofessionals? What exactly is that delivery system? And that's a very important variable in this whole process. Benefit structure is also very important because if I'm entitled to something, what is the something? And if you read the book The System and study what happened with the Clinton administration, I would suggest this is one of the places that fell apart. It's easy to talk about giving everybody access to health care, but the question is, what do they get for free? That's a major consideration. And then financing. Now, obviously, the taxes are what fuel this whole system and get it to work. And the one variable that we have to try to moderate all of this is what's the reimbursement system. Right now, Medicaid and Medicare, one would say, are very economically efficient, but it's because they don't pay full cost to the providers. And because they don't pay full cost, that's one of the things that drives the shortages that we were talking about. But these are the variables that Congress will be dealing with, and those are the considerations. So it's easy, I think, to talk in broad terms. It's when you get into the specifics of these that things degenerate very quickly. Second point that I would make is that in forums like this, it's often stated, there's enough money in the system to cover everybody. So we get everybody covered, we'll be okay. But one of the other things that the Commission learned through the help of the Lewin Group is that, and this is not a scientific graph, this is for a non-actuary, non-economist, this is the best I get. But if this is current cost, and I think we'd all agree that over time with an improved system with better quality and so on and so forth, cost would be at some point lower. But the challenge is we know that there's going to be a peak because we're going to be covering 47 to 50 million people that weren't covered before. We know that there's some pent-up demand, and we know that'll increase costs. What we don't know in this transition is how wide this chasm is or how high it is. And that's relatively important when you think about financing. So from a business perspective, I would say change is needed. We know that. Health care is the #1 issue for small business. Health care is among the top 3 issues for big business. And health care is among the top 2 issues for all Americans today. And the only reason probably it's 2 is when these surveys were done, the Gallup poll and so on, the economic crisis obviously had a significant impact on that. But when we have these debates or discussions in this forum, the room sort of divides in one of 2 sectors. One is access, that we need to provide access to the uninsured, the underinsured. We need to provide an opportunity for people to have access for health care and for coverage. But the other side, which is not often discussed, but is now being discussed to their credit by the Obama administration, is cost. And some would argue, from a business standpoint, the reason we don't have as much access is the system costs too darn much. If we can address the issue of cost, then we'll provide a greater opportunity and for access. This Commissioner of Insurance is here, and this is from her latest report that shows the number of Colorado small business group plans offered in the state. And to put it in perspective, in 2008, small business group plans amounted to about 41,300 businesses covered. And that's out of a universe of about 87,000 small businesses in Colorado. And this is in an environment where we have guaranteed issue, no underwriting, no pre-existing condition limitation, and transition to coverage from plan to plan by federal and state law. So what's wrong, and why aren't more taking it? And arguably, it's the cost. But there are questions that exist, and these are key ones. One of the ones another point that I learned from the work on the 208 Commission through my other commissioners who were more learned than I, was that the key to reform is that we must have a dedicated, sustainable source of funding. Dedicated means that it is focused and will be able to be evaluated over time. Sustainable means that you can't use things like sin taxes and other little tricks to be able to pretend that you have funding, because as utilization goes down, we can't drink enough soda pop in the United States to fund health care based on a tax on soda, as an example. The second question is, can cost really be reduced, and over what time period, and what are the implications? The third is, what's the role of government in making these decisions? The fourth is, what's the role of business? And then fifth, what is the role of the individual? Do we have individual responsibility? The Blue Ribbon Commission recommended an individual mandate. And is that appropriate? And then finally, the 6-point funding, and you notice that I'm a business person, so the first point and the 6th point both relate to money. So I would close by saying we have some tough choices to make. This is not easy, and because there will be, no matter what direction we take, winners and losers, and there's the law of unintended consequences. What are our priorities? Clearly, I think most of us in this room would say that children are a key priority in terms of coverage. But where does it go from there, and what are those priorities? What are the unintended consequences, and can we develop a sense of shared responsibility? Because at the end of the day, that's what we're talking about with healthcare reform, shared responsibility, where all of us contribute in one way or another to a system that is better and benefits all of us. And aren't we all at risk? Thank you.